everyone, my topic is all about COVID-19. COVID-19, short for Coronavirus Disease 2019, is a highly infectious disease caused by coronavirus. It was first identified in December 2019 in China and became global pandemic. These are the signs and symptoms of COVID-19. Be aware if you have this kind of symptoms. First, we have fever, thick cough, shortness of breath, fatigue, headache, sore throat, diarrhea, and vomiting. There are many prevention for having COVID-19. First, you have to wash your hands frequently with soap and water. Wash your hands 2 to 3 minutes every time you wash your hands. Use hand sanitizer or bring sanitizer with you. Social distancing. Social distancing is good for you and for others. Wear face mask in public so that you can protect yourself and others. Stay home if you're sick so you won't affect anyone else. Get vaccinated against COVID-19 so you won't be infected with COVID-19. When you feel difficulty of breathing, chest pain, vomiting, and severe headache, go seek medical attention for consultation. There are many types of treatment for COVID-19. Here are the 3 types of treatment. First, rest and hydration. Drink plenty of water to get dehydrated. 2. Over-the-counter medication. Take your medicine frequently. 3rd, oxygen therapy. And there are many more. So that's all for my report. Thank you for listening.
Good morning, everyone. We were here to discuss about what is TB. Welcome. Today's health segment, we're discussing a serious infectious disease that affects millions of people worldwide. It's a disease that can be cured if treated promptly and properly, but can lead to serious complications and even death if left untreated. We're talking about tuberculosis or TB. Let's take a closer look. So, what is TB? Tuberculosis is a bacterial infection caused by Mycobacterium tuberculosis that primarily affects the lungs but can also affect other parts of the body. It's a serious infectious disease that can be life-threatening if left untreated. Now, let's talk about the signs and symptoms of TB. This can vary depending on the location, severity of the infection. Common signs and symptoms includes a persistent cough that lasts 3 or more weeks, often producing plain or blood chest pain that worsen when coughing or taking deep breath, fatigue, unexplained weight loss, recurring fever, night sweats, and shortness of breath. So, how is TB treated? TB treatment typically involves a combination of antibiotics taken for at least 6 months. The specific treatment regimen may vary depending on the severity of the disease, the presence of any drug, and the patient's overall health. First-line antibiotics such as isoniazid, rifampicin, ethambutol, pyrazinamide, and commonly used to treat TB. Second-line antibiotics may treat drug-resistant TB strains. It's also important to note that TB can be transmitted through air when an infected person coughs, sneezes, or talks, releasing droplets that contains the bacteria. If you suspect or someone you know may have TB, it's essential to consult a healthcare professional for proper diagnosis and treatment. TB is a curable disease if treated promptly and properly. Don't delay seek medical attention if you're experiencing any of the symptoms we discussed today. Join us next time for more health tips and information.
Everyone, my name is Rosalyn Castro. Today, I want to talk to you about a dangerous disease, malaria. It's caused by a tiny parasite and spread through mosquito bites. But don't worry, because malaria can be prevented and treated. If you have a malaria, you may feel very sick, you might get high fever, chills, headache, and feel extremely tired in serious cases. It can even be life-threatening, but there's a good news. You can protect yourself and sleep under a mosquito net, wear a long cloth at night, and keep your surroundings clean. If you feel sick, go to a health center immediately. Early treatment can save your life. Let's go together to stop malaria. Protect yourself, protect your family, and spread the word. Stay safe and stay healthy.
Hello, good day everyone. Today we're going to talk about how HIV and AIDS affects women's body. Human immunodeficiency virus are known to be HIV infection and acquired immunodeficiency syndrome or AIDS. HIV is a virus that attacks the body's immune system, especially CD4 cells or T cells, which are crucial for fighting off infection. AIDS is the late stage of HIV infection when the immune system is severely weakened, making individuals susceptible to life-threatening opportunistic infections and cancer. Signs and symptoms. Early HIV infection, often asymptomatic or mild flu-like symptoms, including fever, headache, rash, fatigue, and swollen lymph nodes. Later stages of HIV infection as the immune system. Weakened symptoms can include persistent fever or night sweats, unexplained weight loss, severed fatigue. Important note: HIV is a communicable disease, meaning it can be transmitted from person to person through bodily fluids like blood, semen, vaginal fluids, and breast milk. Thank you.
Hello everyone, I am Glenn and today we're gonna talk about chickenpox. Chickenpox is also known as a varicella zoster, a viral infection that causes an itchy rush of fluid-filled blister that eventually scab over. And the symptoms of chickenpox are fever, fatigue, headache, and a loss of appetite. Chickenpox is usually lasts about 4 to 7 days. To heal this chickenpox fast, you can try these treatments, like acetaminophen. This can help you with the fevers. Apply some calamine lotion, have some cool baths, and have some rest. There's a lot of things to heal chickenpox fast, but I have no time for this. And that is all for today.
Good day everyone, my name is Princess Anita Pita and I'm talking about the hepatitis A, B, and C. Hepatitis A spread through contaminated food and water, or fever, fatigue, and yellowing skin. So the treatment are rest, hydration, and vaccination. Hepatitis B spread through bodily fluid. The symptoms are fever, fatigue, yellowing skin, just like the other one. The symptoms are fever, fatigue, yellowing skin, just like the other one. And the treatment are antiviral medication and vaccination. Hepatitis C. The last but not the least, hepatitis C spread through blood to blood contact. But not the least, hepatitis C spread through blood to blood contact. Symptoms are fatigue, loss of appetite, and yellowing skin. The treatment are antiviral medications and liver transplant and severe cases. Protect yourself by practice good hygiene and vaccinated. And the least but not the least, protect yourself by practice good hygiene and get vaccinated. And
And the last but not the least, avoid high-risk behavior.
Hello and welcome to our health podcast. I am your host Roxy Gubernier. Today we're talking about the common illness that affect us all, at some point the common cold. So what is a common cold? It's a viral infection that affects our upper respiratory system. It's highly contagious and spread quickly when the affected person talks, coughs, or sneezes. Now let's talk about the symptoms. If you have a cold, you might experience stuffy nose, runny nose, coughing, sneezing, fatigue, and headache. So how do we treat the common cold? Unfortunately, there's no cure, but there are ways to manage the symptoms. Make sure to get plenty of rest, drink a lot of fluids, and use the over-the-counter medications. Remember, antibiotics won't work against viral infections like common cold. Always consult for a healthcare professional if your symptoms get worsened or precise. That's all for today's health podcast. Stay healthy and we'll see you next time.
Good evening, everyone. This is John Sarex de Mendoza, bringing you an important health update. Today, we're talking about measles, what it is, how it spreads, and most importantly, how we can prevent it. Measles are highly contagious viral infection that spreads through coughing, sneezing, or direct contact with an infected person. Symptoms usually begin with fever, cough, runny nose, and red watery eyes, followed by a red rash that spreads all over the body. But don't worry, here's the good news. Measles can be prevented with a safe and effective vaccine. The measles vaccine, often given as a part of a MMR or measles, mumps, and rubella vaccine, is recommended for children and adults who have not been vaccinated. Getting vaccinated or not only protects you but also helps prevent outbreaks in your community. If you or someone you know has symptoms of measles, seek medical attention immediately and avoid close contact with the others to prevent further spread. Let's work together to stop measles. Get vaccinated, stay informed, and spread awareness. Not the virus. This has been John Cyrus de Mendoza with your health update. Stay safe and stay healthy.
Hello everyone, and thank you for tuning in. Today, we're talking about something that affects millions of people worldwide. Sexual transmitted infections, or which is called STIs. STIs are infections spread through sexual contact, including vaginal, anal, and oral sex. Some common ones include chlamydia, gonorrhea, syphilis, herpes, HIV, and HPV. These infections can cause serious health problems if left untreated. But the good news is that many are preventable and treatable. Symptoms of STIs are vary, but may include painful urination, unusual discharge, sores, itching, or even no symptoms at all. This is why regular testing is important, even if you feel fine. If you don't want to get infected by STIs, don't worry. I'll explain you and give you the ways and the best ways and the basic ways to prevent STIs. The first thing to prevent STIs is using condoms every time you have sex. So, what does it mean? Using a condom, if you don't know what a condom looks like, it's like a balloon with a pointy thingy, and it is used for the thingy, for the boy, if you get what I mean. It is very important and the basic way to prevent STIs because it's also important to prevent pregnancy. If you are still not planning, if you're still a teenager or a college student, a guy who is not planned to, not having a kid yet. So. condoms can be bought in pharmacies, but I don't recommend you to do it at a young age. But I recommend like in college, like above 18. I don't know. Enjoy yourself while you're still living. So second is getting tested regularly and know your partner status. What does it mean? And how do I maintain my vision to my partner status? It's easy. All you have to do is you like check her reproductive system, check if she is fine, feeling fine, is alright, or call a doctor if she is feeling unwell to give her a checkup. If you wanna do it, then it's the best way to prevent STIs. So that's all I know. So moving on to the third is limiting your multiple sexual partners. What does it mean and why? The reason why you gotta what does sexual partners is that your partner to have mating process with. A partner in life you like to choose that guy or girl to be the mother of your son or daughter, or the father of your son or daughter. If you're a hoe, you gotta stop. A hoe, if you get what I mean, if you know what a hoe is. If you're a hoe and you know what, you gotta stop it. God is disappointed at you because being a hoe is a bad thing, because attracted to most of the guys just for their thingy. Why aim for the ones who have the bigger ones instead of a guy who is kind, who is perfect but has a small thingy? Size doesn't matter, and love does. And what all I can say about is limiting your sexual partner is that you gotta only choose one partner instead of multiple. It's also a sin that you choose like multiple partners and just you barely know each other's names and you suddenly do the mating process. Back rank mate, scholars mate, smothered mate. Stop. Only choose one partner if you wanna have sex with and have like, and you wanna choose to be the mother of your children or father, whatever. But what the important thing is that the key contribution is that just choose one partner to be with you and to mate with you to increase population, or I don't know anything about population increasement. You just get the point. That's all I want to say. And for the fourth one is getting vaccinated for HPV and hepatitis B. Getting vaccinated can improve your health and also improve your immune system from fighting back from STIs. Getting vaccinated is a very good and common way to prevent STIs, but it is kind of has a rig that it's cost like you need money for that, and I don't know, just do the other stuff to provide. I don't know how they cost. I'm sorry. So the final thing is avoid sharing needles. What does it mean? It means that like using the same needle when it's already used by another person, like a tattoo or a piercing, because if you do this like nothing happened at all, then you won't suspect a thing, like because there's like other infection that spreads through blood, like hepatitis B and C. That's all of the best ways to avoid STIs, and I'm sorry that I cannot explain it well because I'm still learning. And if you think you might have an STI, STI means sexual transmitted infection. Don't panic. Many STIs are treatable with medication. Visit a doctor, get tested, and follow the prescribed treatment. STIs are common, but with the right knowledge you can protect yourself and your loved ones as well. Stay safe, get tested, and make smart choices. That's it for today to my broadcast. Thank you for listening. Thank you for staying. Stay informed and stay healthy. Peace.
Hello everyone, have you ever felt a sudden stomach pain, nausea, vomiting, or diarrhea? You might have stomach flu, also known as viral gastroenteritis. This illness spreads easily through contaminated food, water, or contact with an infected person. Symptoms include watery diarrhea, stomach cramps, fever, and extreme tiredness. If you catch stomach flu, don't panic. Drink plenty of water, eat light foods like bananas and rice, and get lots of rest. Most cases go away on their own, but if you feel too weak or dehydrated, see a doctor immediately. Prevention is key. Wash your hands often, keep food clean, and avoid close contact with sick people. Stay safe, stay healthy.